For over 50 years, activists have threatened that anything short of unfettered abortion on demand will drive the deadly practice underground. Of course, every abortion is unsafe, killing at least one person. But the specter of back-alley abortions has proven to be a powerful tactic to scare the public and their elected officials into opposing even the most modest health and safety regulations on abortion. Don't you think it's time we reevaluate this stale talking point? My name is Dr. Christina Francis. I'm a board-certified OBGYN and CEO of the American Association of Pro-Life OBGYNs, or APLOG. With our colleagues at 3 other medical associations, along with 4 frontline doctors, we are challenging what has become America's largely unregulated and unsupervised chemical abortion regimen. Together with Alliance Defending Freedom, we've filed a federal lawsuit against the Food and Drug Administration, asking the court to reverse the FDA's illegal and irresponsible authorization of harmful chemical abortion drugs. For years, federal agencies recognized that chemical abortion drugs were too dangerous to approve. But in 2000, President Bill Clinton pressured the FDA into disregarding the proper testing procedures and approving chemical abortion drugs. Today, the abortion pill regimen accounts for at least 54% of abortions in the U.S. Things have gotten far worse since 2016, as the FDA has relaxed the already insufficient safety parameters for chemical abortions. In 2000, a woman had to schedule 3 in-person appointments with a doctor. Once for an initial consultation and to receive the first drug, once to receive a second drug, and a third time to confirm that no fetal parts or tissue remained in the uterus. Now, despite a slew of catastrophic health situations arising from the use of these drugs, the FDA has removed all of these safeguards. In December 2021, the FDA permanently removed the in-person dispensing requirement, allowing most prescribing to go virtual. Then, in early 2023, the FDA authorized chemical abortion drugs to be dispensed at corner pharmacies like CVS and Walgreens. While major pharmaceutical companies that manufacture chemical abortion drugs cheered on the FDA's move, it is clearly extremely reckless and constitutes medical and regulatory malpractice. Chemical abortions can result in complications like severe bleeding, infections, and the inability to carry later pregnancies to term. They are especially dangerous for women who are further along in their pregnancies than they realize, or who have ectopic pregnancies. An in-person visit involving an ultrasound is a necessary step to accurately diagnose both gestational age and ectopic pregnancy. But even when the FDA required an in-person visit, the agency never required an ultrasound to screen for these life-threatening conditions. The FDA and abortionists are lying to women when they say that chemical abortion drugs are safe. With the FDA's blessing, women take these drugs at home, in a dorm room, or even in a hotel room, alone, with no indication of the horrors that await. Sometimes, abortionists even recommend that women pass the fetus into a toilet and not look. Women who do look are often horrified to find that the baby, who they were told was just a clump of cells, has hands, feet, fingers, and toes. In one case, the abortionist assumed that a woman was about 6 weeks pregnant, but after taking the chemical abortion drugs alone in her bathroom, the woman delivered a fully formed baby, well into her 3rd trimester, at a time that the baby could have survived if given appropriate medical care. In the all too frequent emergency situations that arise, the abortionist who provided these dangerous drugs abandons their duty to care for women, and emergency room doctors and on-call OBGYNs have to fill the gap. The FDA also acknowledges that 28 women have died from complications after taking chemical abortion drugs since 2000, an estimate that is very likely on the low side, considering the lack of reporting and tracking requirements around these drugs. The FDA's approval of chemical abortion drugs and its continual removal of safety requirements for chemical abortions place politics above women's health. In doing so, the FDA is betraying its mission of protecting public health. We're suing because we've had enough of the FDA's illegal endangerment of women and girls. Our patients deserve better, and we're confident that the courts will agree. To follow this case, visit adflegal.org. You can find more videos like this at adflegal.org/Freedom Matters. While you're here, like this video and subscribe to this channel so you don't miss an episode.